Afternoon, everybody. Thank you so much for joining. On today's call, we are going to be covering America's Choice and specifically the 500 Max product. There's like a dozen different products in the America's Choice portfolio. And on our previous call, we covered the whole thing, and it was a lot, and it's recorded. So when we jump into the training, I'm going to post into the chat a link so you can find the recording. So we're not going to cover the whole America's Choice here. I'm sorry if you missed the call. You can just go back to the recording. Today, we're just going to focus on the Max 500 for just a couple of real quick reasons I'll share. First of all, it is affordable, which is going to be really important. It's not subsidy eligible, so you want to have a plan that you can talk to your clients about that's affordable. Second, it's one of the most popularly sold products, so you're going to want to know why agents are selling this thing. Third, the commissions are really good. Lynn, you and I were talking about this earlier this week. Commissions are strong. Product is strong. There's a lot to like about this. We have this available in almost all states, not quite all. I think 45, 44, 45, something like that. 44, with a couple notable exceptions out west and a couple out east, and otherwise pretty much everywhere else. So there's a lot to like. So we're going to focus just on that product here for about the next 15 or 20 minutes. This call is being recorded, and we'll go into our YouTube channel. Some more people joining. And then we'll leave about 5 or 10 minutes for questions at the end, whether you want to put them in the chat or whether you just want to unmute your phone. Everybody's lines are muted. With all that being said, Michael, thank you so much for joining and helping us out with the training. I'll go ahead and turn it over to you.
All right, beautiful. Thanks, Andy. Can you guys see my screen? Did that work? All right, so I'm not a Teams guy. All right, so the annual Max plan, guys, like Andy mentioned, is by far the most popular plan in the America's Choice program. It's almost 70% of all enrollments are coming with this annual Max 500 plan. And there's a lot of reasons for that, and we'll get into a few of them here as we get started. But the thing you need to understand about the annual Max plan right off the gate, and I get this question all the time, just because it is called annual Max does not mean it's a fixed benefit plan. This is major medical, okay? It just comes with some annual caps and lifetime caps on the coverage. So a couple highlights here to really point out. With these annual Max plans, and especially the annual Max 500, there is no deductible, okay? It is all copay based, which people really like. In the name, why they call it the annual Max 500 is because it comes with a $500,000 annual max. So per person, the most that the plan will pay out in a given year, in a policy year, is $500,000. And then there's a $2.5 million lifetime max on this, okay? Just like any of the other America's Choice programs, there are no pre-existing exclusions. As long as you can pass those 11 underwriting questions, you are accepted, okay? And then day one, anything you have going on is covered, right? So there's no waiting periods. The annual Max plan comes with all the 64 ACA preventative services, all right, at no cost. There is a $0 copay for all telemedicine, and I'll touch base on that just a little bit as we go through the benefits. That comes with primary, urgent, and mental health opportunities. Cancer is covered on this plan, all right? That's another question we get a lot, is what happens with this plan if I get diagnosed with cancer? It does have cancer, and that's, again, another one of the benefits that we'll cover on here. We'll go through the pharmacy program that's part of this. And then, as Andy talked about before, the rates are very affordable and the commissions are obviously great. So again, the annual Max program, no deductible, everything is copay based. So on your screen here, hopefully you guys can see this in the presentation, and then you all have access to the brochures. What does actually have a copay and what those copays are. So your primary care physician office visits, guys, everything is a $50 per visit copay with a max of 10 per year, which if you're going more than 10 times per year, there's probably a good chance you didn't make it past the 11 underwriting questions that took you onto this plan. Okay. That covers specialists, covers physical and occupational therapy, speech therapy, urgent care is all under that $50 copay. Telemedicine, I put a little star next to it because it is worth focusing on. All of the telemedicine benefits that are built into this program are zero copays. It's free, okay? So you can get a primary care physician. You'll actually be assigned a primary care physician the first time you call in, and you keep that physician the entire life of your program. So you'll have access to that same doctor every time you call in using the telemedicine feature. Urgent care is kind of whoever's on call. So if it's an emergency, whatever, you're going to use the urgent care part of it. You're going to get whoever's on call. And then mental health, you'll have an assigned provider. Preventative services, like we talked about before, all 64 MEC benefits come with this. They are $0 copays. They'll pay, when you see 100% of allowable on this, that means they'll pay 100% of what the negotiated rate is with that facility. Okay. Physician services, again, primary care physician office visits, it's 100% after the copay. So again, you pay your copay, it pays for 100% after that copay. If you go outside of the network, if you happen to be in a non-network facility, it's going to pay 100% of the plan allowable negotiated rate. And if that happens to leave anything left over, then your insured member's responsible for it. Diagnostic testing, lab x-rays, again, those are $50 copays per visit. You get 3 visits per plan year per member. Surgical services comes with a $250 copay per surgery. You get 3 planned surgeries per year. So $250 for surgery is pretty darn good. Let's see, emergency room, again, $250 copay. You get 2 ER visits for accident per year, 2 visits for sick. So that's a total of 4 that you can use that $250 copay on in a given year. Let's see here. Ambulance services, again, 100% covered. You get 2 transports per year, so that's covered at no expense. Room and board, it's a $1,000 copay when you get I can't talk today. When you get admitted to the hospital, so $1,000 copay per. You get 2 of those per year. There is a 10-day limit on hospitalization at that $1,000 copay. Same thing with ICU, $1,000 copay per admission. You get 3 hospitalizations for ICU, again with that 10-day limit. Maternity. I'm going to skip down to maternity because this is the one that everybody goes, no way is this true. I've seen it work. We have clients that have done it. It is true. A $250 copay for maternity benefits. All right. So as long as you have, a traditional vaginal delivery, it's a $250 copay. If for whatever reason you have to have the C-section, then it's a $500 copay. Okay. Which is, I have 2 kids. If you guys have kids, you know it's a heck of a lot more than that to deliver a child. So.
Yeah, the average cost of just the delivery is usually $10,000, $15,000+ $1,000, and that's just average. And then if you add all the other stuff that you have to do, sorry, ladies, I'm sorry, I'm minimizing what stuff means. It's usually another 10 or 15. Usually, anyway, the average, if it was just totally cash, is usually about 25 grand. So if you're getting it for $500,
yeah, and you can. I'd wager to bet, and just talking to agents around the country, that's probably the number one reason why this is 70% of our enrollments. If you have a young family, you're planning on starting a family, I mean, that benefit right there is incredibly attractive.
Just can't be currently pregnant. That's really the only
correct
thing to keep in mind. Thanks, Chris. You're right. Can't be pregnant when you start, but if you're planning on a family, this is the way to go.
So let's talk about that for a second, because I always get that question too. The way that they're handling pregnancy is as long as you can prove that you didn't know you were pregnant when you answered those 11 questions and got onto the plan, they will cover it. So as you guys know, you don't always know you're pregnant the day you get pregnant. It could be a month later. That's when you actually go to the doctor, figure it out. They will cover that. What they just don't want to see is somebody get onto the plan and give birth 4 months into it. Okay, but they're going to be a little loose on that. Let's just see here. We talked about cancer. Cancer does have a $25,000 maximum benefit it will pay. So you might want to, if you guys have critical illness plans, things of that nature, you always want to make sure you bundle those in. Substance abuse is covered on this under a $250 copay. Allergy shots, I don't know, Andy, if you want me to go through every single one of the benefits, but there's just hitting some of the highlights. Prosthetics are covered on this plan with a copay. The biggest thing to understand with this one, and another question that Katie and Wadia get a lot, is how does the pharmacy work? So with the annual max plans, the pharmacy formulary is a little bit more geared towards your acute medicines. It's not going to have coverage for the specialty meds. It's more designed for acute and maintenance medications. All right. They do offer home delivery with tracking through UPS, so you can do mail order prescriptions, and they have either 30 or 90-day supply options. Okay, which again covers most of the people you're going to be talking to.
Premiums, and it does cover Ozempic. We talked about that on the last call. That's another one, guys, that we get asked a lot. Do we have anything that covers Ozempic? Anyway, we got something that covers Ozempic.
Yep. Yeah, it's a $45 copay, if I remember correctly.
That's a hell of a deal.
Which is great. Yep. So on your screens here, what I currently have today as of March 21st, these are the rates for the plan. And I make a point to say that because on March 24th, we are adding another age band for that 18 to 30-year-old. I don't know exactly what the rate is. We're hearing 15 to 20% lower. But once that's published, you guys will see it in your quoting software. Okay. So for an employee, it's $479, employee spouse $679, employee child $629, and then an entire family with no limit to how many children is $929. So again, making that very attractive for that self-employed individual that doesn't receive a huge subsidy for the ACA and is looking at a full-priced major medical option. Okay. So the network on this plan is the PHCS, Practitioner and Ancillary Network. A couple things to understand about the network is you always want to make sure you're checking for your doctors. Katie, I don't know if, Andy, if you want Katie to go through the quoting site or not, or we can reference the training video that you had, but you always want to make sure that your primary care physician is in network. If for whatever reason they don't show up in the network currently, you can nominate them. And we're adding doctors every day through that nomination process. Guys, hospitals and facilities do not show up in that network search. So if you go in there and you try to search for a facility using that particular network search, it's not going to appear, and that's by design. That network search is just for practitioners. It's just for the doctors. Okay. The way that hospitals and facilities work is that if it is an emergency, you can go anywhere, and Detago, who's the TP on this, will just negotiate the bill and take care of it behind the scenes. So go get the care taken. If it is a scheduled visit, okay, so you have an upcoming surgery, you got an upcoming visit, they ask that you do a pre-certification. So everybody's going to have a number on their insurance card that they just call Detago, and Detago will take it from there. Okay, we've done it 1,000 times. It's seamless, and this happens behind the scenes anyway with any plan that you're on. They just want to make sure that they can negotiate the rate with the facility for whatever your care is. What's really cool about that, which we've seen, is that if it's a scheduled surgery or something a little bit bigger, Datego will actually take the time to go and also call a couple facilities within a, call it 15, 20-minute radius of wherever you're asking to go. And if they can work out a better deal with another facility, they will actually make an offer to your member to say eliminate half the deductible or eliminate the deductible, or I shouldn't say deductible because we're talking about the annual max plan. But on the other ones, they would, eliminate some of the out-of-pocket expense. Emergencies, like I said, don't require a pre-cert, so you can go anywhere to get that treatment done. If it is an out-of-network doctor, Datego will pay the in-network rate. So they'll pay them whatever the negotiated in-network rate was. Out-of-network hospitals and surgeries, everything's RBP, and they pay up to 4 times Medicare. So we have yet to have any facility not accept one of our members because of being out of network. Important dates and cutoffs to remember with this plan, guys. They all come with first of the month effective dates. All right, so every plan is going to be as of the first of the month. The 23rd of the month, which we're coming up on here, is the last day that you can enroll somebody for the next upcoming first of the month. So at 11:59 p.m. is the last you can enroll them. All right, come to the 24th, it's going to be the first of the following month. All initial premiums are taken upon application, so upon your initial application, and then all future premiums always come out on the 20th of the month. You have to submit the plan prior to turning 63. So Andy, if you're turning 63 tomorrow, I need to make sure I get your application in today. You can still turn 63 tomorrow before the plan goes into effect and you're fine. The application just has to be submitted prior to turning age 63. It does take about 7 to 10 business days to receive the physical insurance cards. There's a lot of people enrolling in this program right now. They're staying on top of it, but don't set the expectation that we're going to sign up today and within the next couple of days you'll have the card. Give them 7 to 10 days to mail out that card. However, you do get what we call a soft card right away that your client can print off and get access to their member number, all that kind of stuff. The benefit year is calendar, so it runs January 1st through December 31st. And the rate years are July 1st through June 31st. Okay. Now, these annual max plans have never had a rate increase. All right, we've yet to see a rate increase on the annual max plans. The metal plans will have a, on average about a 2% rate increase each year. And then these are your important support numbers that you want to keep track of. So Datego is who handles everything for your members. That's the Datego support number. That's also the pre-certification number. They are open 7 to 5 Central, Monday through Friday. Member services at Datego Health is the email address. And then our support number, which is for you guys, the agent support, that's going to be Katie and Wadia. There's their direct line and their email address. So at this point, I know, Andy, we're a little limited on time, so we got like 10 minutes left, I think. I guess we could open it up for some questions.
Yeah, please, guys, either unmute your phone if you have questions or feel free to type them into the chat. To kind of get things started, Michael, just a couple comments about this product. I mean, again, I want to reiterate, available in 44 states. Pricing is super simple, even though we're going to see a little different a scaled price for those younger members. Still super simple. I mean, basically an individual's $500. The commissions are really strong, benefits are really strong. I did want to take a second though and remind everybody about the cancer limitation. 25 grand, pretty limited. So make sure that you're stacking, to Michael's point, a critical illness plan. Pick your favorite one. Michael, the one that we probably sell the most of are from like Manhattan or Allstate or that kind of cast of characters. So don't forget to do that, guys. And this product gives you the perfect opportunity to do it by saying, look, you got to do this. And so I don't even think you should make it optional. It's like, Mrs. Jones, if you're going to buy this plan, you got a critical illness, and I won't hear different because you're just going to be unhappy later when there's a limitation. Another great product, and I'll ask Chris or Lynn to speak to this, is Manhattan's Cancer Care Plus, because that one doesn't have a cap on it. It's the only one we have that doesn't have a cap. Anyway, questions, comments, thoughts, guys? I'm just tap dancing for a minute while people are ready to ask questions. No, seriously?
I don't think I did that good of a job.
You like this one, Chris? So Chris was just saying she likes this for some of her clients. Chris is one of our biggest ACA producers. So, you know, Chris, Lynn, anybody jump in, like, where do you guys see this fitting compared to an ACA plan? When would you sell this? When would you sell an ACA plan? Lynn, you're in Texas. I can already tell you what your answer is going to be.
Hey, Andy. Well, I actually sold 2 this week, and you know, I mean, I think where it fits is for higher income individuals that aren't getting a tax credit and they want better protection. I mean, I've been selling indemnity for a long time and I like it, but you know, I think that this is more palatable because you know, it's a major medical plan. And I really like the metal plans. That's what I sold this week. So I'm excited about digging in deeper and learning, you know, more about it. The application process was all I can say is do email signature, don't do text signature. It's a little bit cumbersome on the text signature process, but the application process was super easy. You know, so far I really liked it a lot.
Nice. And as a reminder, thanks for the feedback, Lynn. For those of you who want a tutorial on the quoting that Lynn just described, we did a walkthrough on our last call. So once again, please go back and watch the recording from back a couple of weeks ago, so we don't have to do that again. Chris, anything you'd like to add? Comments, questions, thoughts?
I could see this. So I have people that I flip-flop short-term year after year after year, you know, because it's the 364 rule in our state. And after about the 3rd year, they're kind of like, is there something I can just get in and just leave it? And this is, I can see this being a good fit. Because yeah, it's for the people who don't qualify for tax credit, or maybe they missed open enrollment and they maybe would qualify for tax credit, but they need something in the meantime. But and if the cliff comes back, you guys will be very popular if the income cliff comes back.
Well, and I'll tell you this too, Chris. I mean, I'm not a betting man, but I would bet that short-term medical will no longer be allowed to be even 364, much less anything different from that. I think we're going back to 3-month short-term medical, and I think that's going to happen in the next 60 days. And I think if you ask the short-term medical carriers, they will even tell you that, but that's what they're expecting too. So now is the time to start thinking about making the transition, guys. If you have a client that has a long-term need for a health plan, this is the way to go. If you have somebody who's in between jobs, you could do short-term medical. You got somebody that is bridging to Medicare, you can do that, short-term medical. But I think the days of it being extended for a period of years, I think that we need to make the transition now because we're going to be forced to, whether we want to or not.
And Andy, if I could throw in one comment on that too, and this is a big reason for that extra age band that's about to come out in the next couple of days, is this is the 500 plan especially was designed for that young invincible crowd. You guys know what I mean when I say that, right? That 18 to 40 something, which I still try to identify as a crowd that says, you know what, I'm never going to get sick enough to hit a deductible. I'm never going to get sick enough to hit a $7,000-8,000 out of pocket. So I don't see the reason for having health insurance. They love a plan like this because the first time they go to use it, they feel it working for them. And that's because of those copays, right? So that's very attractive to that demographic.
Hey, Michael, I noticed that you put yourself into the 18 to 40 bucket and you put me into the 63 bucket. So we're going to have to take that offline, man.
Yeah.
Other questions before we run out of time? Great stuff. Wadia, could you please send us a copy of this presentation? We sure would appreciate it. The call has been recorded. So for those of you who want to go back, I've already posted the link to where you can find all our recordings. Give our marketing department 48 hours though, so probably this will show up on Monday. Don't forget to get contracted, guys. Please do that first. It just takes a minute. In the link that I sent you guys, contracting instructions are in there as well. It's kind of your one-stop shop for everything that you need, including last time's PowerPoints also in there. So please check it out. The link is in the chat. Thanks so much for joining, folks. Michael, Katie, Wadia, thank you so much. Appreciate you guys being here. Have a great day.